everyone, I'm Laura with Kansas City Mom Collective, and today we're chatting with Dr. Vasvi Singh with HCA Midwest Health. She is a cardiologist there, and she's going to discuss how important factors that affect women's heart disease risk. Let's just go ahead and jump in. So how is heart disease risk calculated?
Well, thanks so much, Laura, for having us. Yeah, absolutely. So there are several risk factors that play a vital role in calculating heart disease risk. And broadly, you can just classify them as modifiable and non-modifiable risk factors. So for example, age, gender, race, family history of heart disease, they are non-modifiable, whereas high cholesterol levels, blood pressure, diabetes, kidney disease, or other lifestyle factors like cigarette smoking, diet, exercise, excessive alcohol use, obesity, or many other psychosocial factors, they collectively determine one's individual disease risk. So it is a composite risk calculator.
Okay. Are there any specific factors for females?
Absolutely. So there are certainly unique heart health challenges that women face. Estrogen hormone is protective of the heart in the premenopausal years. It relaxes the arteries, promotes good cholesterol. But as menopause approaches, the estrogen levels, they decline. And then therefore, we see more cardiovascular risk factors such as high cholesterol and hypertension arising in women post-menopausal.
Okay. So how do we find out about our risk?
Yeah, so there are several calculators that have now been developed after intensive population research that are available at the website for American Heart Association, American College of Cardiology websites that can predict your 10-year risk of developing heart disease. Also, imaging, especially a specialized CT scan of the heart arteries that can show any plaque buildup, either soft or hard, and that can allow women to have prompt initiation of effective therapies so that long-term complications or what we call hard cardiac events, such as a heart attack, do not happen.
Okay, so is that test something that we get at a certain age that a doctor recommends based on our risk factors? How do we know when we're supposed to get that?
Absolutely. So it's a combination. So many times, if you have, for example, a family history of heart disease very early in age, or you are born with very high cholesterol levels, or you're beginning to have symptoms that could be related to heart disease, would be the time that your cardiologist or primary care doctor will order a coronary CTA or a CT scan to look at heart arteries.
Okay. So going back to earlier in the female health, how does pregnancy and pregnancy complications affect the heart?
Yeah, so unfortunately, at this time, less than half of women entering pregnancy in the United States have good heart health. And cardiovascular disease is the #1 killer of new moms, and it accounts for 1/3 of maternal mortality. Black women, especially, they have some of the highest maternal mortality rates, unfortunately. Also, if a woman who's when pregnant faces a health issue during pregnancy, such as high blood pressure, preeclampsia, gestational diabetes, then that greatly increases the mom's risk for developing cardiovascular disease later in life. And that is very important to understand.
Okay. What about women who take birth control or hormone therapy?
Right. So the typical questions that arise around initiating combined estrogen, progesterone contraception, they are potential side effects such as weight gain, mood changes, libido, or what about return of fertility? And the correct answer is that individual experiences may vary. However, these are generally uncommon side effects. In general, the use of combined hormone contraception pills do not appear to result in significant weight gain, either gain or loss, and that has been proved through meta-analyses of several clinical trials. Similarly, they do not negatively impact mood for most women and does not appear to significantly impact libido either. The pills may slightly delay time to contraception. However, this effect is limited to the first several months after discontinuation of the pill. However, On the other side, many desirable effects that often outweigh the less frequent risks exist. So, for example, there's a lesser chance of having ovarian cysts or menstrual bleeding and cramping, and improved acne when taking combined contraception pills. Now, caution, however, is advised in certain specific group of individuals that may be at high risk of forming blood clots. Like, for example, if you have a history of clotting disorder in the family, or you've previously had blood clots, or women who are actively smoking, then those are definitely individual patient considerations to have.
Okay.
With regards to hormone replacement therapy, typically most commonly used low doses of transdermal estrogen, it does not appear to be associated with excessive risk of stroke. Now, there is a small but significantly increased risk of clot formation with hormone therapy. However, for a healthy postmenopausal woman, the absolute risk is really still extremely small. And then transdermal estrogen preparations, therefore, do not appear to be associated in excess risk if you're otherwise in good health. Again, if somebody has a history of a clotting disorder, obesity, or as you get older, then the risk of clot formation, which is the primary concern with hormone replacement therapy, that may go up.
Okay. So you kind of touched on this, but does being in perimenopause or menopause affect heart health, or is it kind of after they finish menopause?
Right. So going through menopause itself does not cause cardiovascular disease. However, the approach of menopause, it does mark an important point in midlife when a woman's cardiovascular risk factors, they start accelerating and making it extremely important to have an increased focus on your cardiovascular health during this stage. So, for example, the low density lipoprotein, which is what we call the bad cholesterol, it generally rises more in age, especially once women start becoming perimenopausal, and especially so after the age of 55, and that will be attributable to menopause itself.
Okay. So what are some ways that women, no matter what stage they're in life, can reduce their risk?
Right. So a large number of cardiac and stroke events, they can be prevented through education and lifestyle, such as regular exercise, eating smart, managing your blood pressure, cholesterol levels, sugar levels if you have diabetes. Now, cardiovascular disease kills more women than all forms of cancer combined. And it is still a small proportion of women that recognize that heart disease is their greatest health threat. So community awareness initiatives such as this one, they are extremely important.
That's great. Is there a difference then in heart disease treatment for women than men?
Yeah, so there are significant differences between women and men in how they present with heart disease, but then also overall outcomes after needing interventions. So, for example, women often have more risk factors and underlying comorbidities that lead to worse outcomes. And a part of this is also that they may have delayed presentation. And because a large number of women, when compared to men, they present with more atypical symptoms of a heart attack where they may not have the typical crushing chest pain. Instead, they may feel just shortness of breath. They may feel more chest tightness rather than pain, or they may feel an ability that I'm not able to catch my breath, or I'm feeling like extremely fatigued and wiped out with everyday tasks that were previously completely fine to complete. So, therefore, spreading awareness that women typically may present more atypically with heart disease symptoms is very crucial. Another distinct condition called microvascular disease, it occurs very commonly in women. So where there are very small arteries of the heart, so if you were to imagine the heart circulation to be like a tree with branches, then the very small twigs that actually constitute up to 2/3 of the heart circulation, they get diseased very commonly in women compared to the bigger arteries. And therefore, they can cause similar symptoms and prognosis in addition to blockages of the bigger arteries. And that is a very important consideration of microvascular disease in women causing angina and heart attacks.
Okay. Is there anything else you would like our audience to know about heart disease and risks?
Yeah, I mean, me as a physician, I think one important factor for us as a society to recognize is that women continue to be, underrepresented in the STEM fields. In fact, women, they occupy nearly half of the jobs in the United States. However, one-third of the jobs in the STEM fields. And that also translates into lesser clinical cardiovascular trial participation of women which become underrepresented. So I feel like as a community, those are things that we can all work towards improving.
Okay, I love that. Well, thank you so much, Dr. Singh, for your knowledge and helping to educate our audience on their risk and what they can do to prevent heart disease in their lives. Um, do you know if your heart is healthy? Knowing if it's at risk for disease can help you make choices that keep it beating strong. Learn more and take a heart health risk assessment at hcamidwest.com/heart. Thank you, everyone.
Thank you. Bye.